The clavicle, see, middle end, lateral end, shaft. Middle end, it is going to articulate with the sternum to form a sternoclavicular joint. It is a saddle variety of the joint. Whereas the lateral end, it is flattened. It is going to articulate with the acromion process of the scapula to form a acromioclavicular joint. It is a plain synovial joint. It is having the superior surface and inferior surface. So inferior surface we can identify the trapezoid tubercle and conoid tubercles are there. Conoid tubercle, trapezoid tubercles. These two tubercles present inferior surface. Whereas the superior surface, this is a superior surface. And also this lateral end, anterior border, this is the posterior border. So this is the anterior border, this is the posterior border. Next, shaft. Shaft is divided into two parts, medial 2/3, lateral 1/3. So medial 2/3, it having the superior surface, inferior surface, anterior surface, posterior surface are there. So mainly the superior surface gives origin of sternocleidomastoid muscle. So this is the sternocleidomastoid muscle. Here superiorly sternocleidomastoid, one of the head, sternocleido. It having the two heads are there. One head from the sternum, another head from the clavicle. So clavicular part which takes origin from the superior surface of the clavicle, whereas the pectoralis major, it gives insertion. See, that is anterior surface of the middle 2/3, anterior surface nearer to this sternoclavicular joint. See, this is the anterior surface of the clavicle, gives origin of pectoralis major. So pectoralis major takes origin middle 2/3 of the anterior surface of the clavicle, whereas the superior surface gives origin for the clavicular head of the sternocleidomastoid muscle. Next, another one here, deltoid muscle also, it takes origin from this lateral end, anterior surface. See, acromion process, lateral 1/3 gives origin, anterior fibers of the deltoid muscle fibers, whereas the posterior fibers, these posterior fibers, posteriorly, this gives insertion of the trapezius muscle. So acromion process, posterior border gives insertion of the trapezius muscle, origin for the deltoid muscle. Next, whereas here one muscle takes origin, that is the sternocleidomastoid muscle, middle 2/3 of the shaft, whereas here this is the origin of the that is pectoralis major muscle. Whereas the inferior surface of the shaft, here we can identify the one groove is there. This is the one groove. See here, this groove is extends. This is nothing but a subclavian groove always present inferior surface of the shaft, middle 2/3 of the clavicle. And also here we can identify the inferior surface, conoid tubercle is present inferior surface of the shaft of the clavicle. These are the main important muscles. They are asking in the Viva, just important muscles. Sternocleidomastoid muscle, this is the sternocleidomastoid muscle, pectoralis major muscle, this is the deltoid muscle, this is the trapezius muscle. You consider these, at least these four muscles, important muscles, may expect in the Viva questions. And also ossification centers. Here two primary centers, that two present in the shaft of the clavicle. Two primary centers, two secondary centers. One is the middle end, another one in the lateral end. Next, applied anatomy of the clavicle. Mainly the fractures takes place at the junction of the medial 2/3 of the shaft, lateral 1/3 of the clavicle. Where exactly? Here this junction, here the fractures very frequently takes place when fall down the lateral side, medial 2/3 and lateral 1/3 fracture takes place. This is about the osteology of clavicle. Thank you.